So today I'm going to talk about how you clean your wound whenever you've had the umbilical hernia repair. My doctor told me that I need to use antibacterial soap. He said Dial is preferred. So I mean, I'm sure any antibacterial soap is probably okay, but I always pretty much try to stick to what the doctor says. So I bought two different types of Dial antibacterial soap. The first one was just the regular bar and the bars, and I bought them by like a bulk pack. So I keep them in my side drawer here in my bathroom, and they look like that whenever they're open. But I also have the Dial gel, antibacterial gel, because when I'm cleaning out the wound, it seems like if I rub soap over the bars, it's kind of painful because of the pressure at first. You know, at this point, I am a week and 3 days out, so not so much of pain anymore for that. But I used the gel at first because it's very delicate, and also I wanted to clean inside my belly button, and I had incisions in my belly button. So I was like, oh man, I gotta be careful with this. So I used the gel for that for the first probably week to 10 days. And then I started using the bar on it. But and I used the bar on the rest of my body too. Like I didn't just change out and use regular soap, because you want to keep all of the bacteria that's anywhere even close away from the wound. But also, since I had my belly button swole because of the incisions and kind of closed up, I'll show you what I'm talking about. It's not super closed like it was when I had the hernia, but it's closed a little. It's not totally open. You can't see the back. I can stick my finger in there. But since it closed up, I clean my belly button out after every shower and make sure that it's dry. Even at the beginning, I did it super delicately at the beginning when it was still painful and hurting. But you got to keep water out because water breeds bacteria. So I'll show you how I do that in a second. Okay, so I just got out of the shower, and I'm going to show you how I clean my belly button with Q-tips. Because what's the problem is that when you get out of the shower, you have moisture in there, and bacteria will grow in a moist environment. So you want to make sure that it's clean and dry. And in my case, obviously, I've got that kind of knot, and so the knot swells a little bit, and it keeps enough pressure that water can stay trapped in there. So this is how I get that water out, and make sure that I don't have moisture in there so that it doesn't get infected. Okay, so I'll stick that Q-tip up in there and just kind of work it around the top where I can feel it give, and I'll spin it. I'll roll it while it's in there, pull it out. Actually, I smell it too. I smell it to see if it smells like it has a foul smell, or because that indicates infection. And I know it might seem gross, but it's a good indicator. And it doesn't. It just smells salty, actually. So that's good. And I usually use 2 Q-tips. And let's see if I can pull it up there a little bit. There's a little bit, it's hard to see, but there's also still that one. I had an incision inside that they glued, and it's come unglued already, but it still hurts a little bit. But I make sure that I get all of that dry. I run that Q-tip as deep as I can without pain, and on both tips. And that's about it for cleaning my belly button out. So there's that. So that's basically how I clean out my belly button. I want to add, I didn't show you in the video, but I usually, after the shower, I stand in front of a fan and have the fan kind of against the wall and angled up so that it's at a 45-degree angle. And I stand there and I let the air blow into my belly button as much as it can and dry everything up, because the last thing you want is to have like a fungal infection or a yeast or anything like that. You want to keep it as dry as you can keep it so that it keeps all, bacteria and things like that from growing. So just take really good care of the wound so that you avoid an infection. Knock on wood, I haven't had any, knock on wood, I haven't had any infection. I have that knot, which I super suspect that it's a seroma, like he said. I think it's starting to soften up a little bit. I still use that vibrator. I don't know if you saw it in one of my other videos, but I use this giant vibrating head, which is right here. Yep. I use that on it just about every day because I'm trying to keep that down and make sure that that goes away. It does feel like it's starting to soften up. So I believe that's working. Anyways, take care of the wound. Keep it clean, and you shouldn't have any problems. I hope that you don't. Good luck.